Okay, let's face it, as we get older, we know our bodies just aren't the same.
The wear and tear on our joints can cause osteoarthritis, the most common form of arthritis.
So today, Dr. James Lebolt, an orthopedic surgeon with Spectrum Health Medical Group, is here today to talk with us about kind of those things that happen as we age.
Sure. As we age, some of the cells in the knee start to break down. So I explain arthritis to my patients as not the presence of something, but the absence. So you start to miss normal cartilage in the knee. With that, we have lots of conservative treatment options that we can do, injections, activity modification. Sometimes it focuses on counseling about weight loss type activities as well. But one of the new technologies out now for knee arthritis is a new knee replacement that's been recently approved by the FDA.
Wow, interesting. Okay, so people start noticing that the knees aren't what they used to be. What are they coming to you? You know, I bet people are at all different sorts of levels. I'm starting to notice it, or like, I noticed it 3 years ago and I haven't done anything. But life, it's just basically starts to change for people, and that's not a good thing.
It does. For some of my marathoners, it really starts to slow them down. They'll say, I get in mile 3, 4, 5 and my knees start to ache, or I get up in the morning and my knees are stiff. What can I do about it, or what can I change in my lifestyle? And certainly we have a lot of things we can do conservatively without surgery to help these folks that are in some of these early stages of arthritis.
So is this something eventually that will impact all of us, or are there certain behaviors, certain things that are about us personally that can maybe cause this breakdown to occur?
I'll tell you, the biggest factor is genetics, and we can't change that right now. As technology evolves and we work with gene therapy, there may be a day that we can cure arthritis. But right now, the biggest factor is genetics. The second is wear and tear, whether it's due to sports participation when we were young, sports injuries, car accidents, other injuries like that. Sometimes just bad luck plays a role as well.
What about being overweight?
Overweight is a big issue, and we see that a lot in our office, and we have to approach that very delicately with our patients. But that's certainly, particularly in this day and age, one of the biggest factors we see now for knee pain.
Okay, so a lot of people have problems. Let's talk about available treatments. You started touching upon that a little bit, and some people are a little afraid to go the surgical route.
Yeah, just because you come to the surgeon doesn't mean you get signed up instantly for surgery. So we try, at least in my practice and a lot of the practices here, we try to exhaust our conservative options first. So whether it would be injections, whether it would be physical therapy, really the muscles in the leg are your shock absorbers for the knee. So if we can keep those strong and flexible, that will take a lot of stress off the knee. The injections we have hyaluronic acid injections, which are a lubricant injection of the knee. When the knee is normal, it makes this substance, and as it gets arthritic or you start to lose some of this cartilage, you make less, and this injection type material helps replenish that amount to the knee, and it gets a lot of people, particularly my younger arthritic people, some relief.
So the sooner you come in to see someone like yourself for some treatments or recommendations or for a plan, the better off you are. Maybe you're able to postpone surgery a little longer.
Well, you know, I think it's a good idea. You can start with your primary care physician. A lot of things can be over-the-counter anti-inflammatories, Tylenol, Aleve, ibuprofen. Some primary care physicians will recommend glucosamine chondroitin, which is an over-the-counter supplement for joints. And I would say if the pain persists past those levels, or if you tried those things and they aren't working, it may be worth a visit to the orthopedic surgeon.
See, we don't get to look inside our bodies, but we do have a picture of what somebody that is experiencing some trouble might see. We have a picture of a good knee and a bad knee, basically.
So the knee on the right in the illustration is actually an arthritic knee. You can see the loss of cartilage there. The knee on the left actually is one that's been resurfaced or reshaped for a knee replacement implant. And as I mentioned earlier, the recent approval, there is now a 30-year knee replacement that is on the market that's been FDA approved. Traditionally, we told folks that knee replacements would last 10-15 years and wear out. With this 30-year material, less friction, less wear on the plastic or the poly that goes into the knee implant. So it's a great option for our younger and our older arthritic people as well to reduce the amount of wear in the knee.
So is it just a different material, or is the whole process different to make it last longer?
Two things. Proprietary information. technology from a particular company, but the two things that go into this implant, one is the metal. So we used to use cobalt chrome, very similar to the bumpers on a car. Now we use, it's called zirconium. And with that material, it has a lower coefficient of friction, just means less wear in the plastics. And the other piece of technology with that is the plastic that goes into knee replacement itself. So it's a harder, more dense plastic, which leads to less wear. So we measure wear in the knee as cycles of the knee, how many times a knee bends. And with this material, the knee can bend a lot more. And what they've replicated in the lab is up to 30 years of wear without the knee wearing out.
Wow, that's amazing.
Yeah.
You have a seminar tonight that people who may have some questions or may be interested in some of this technology can come out. It's a knee replacement seminar.
We're talking about this new technology down in Hudsonville tonight at 7 o'clock, and you can sign up at Spectrum Health Medical Group's website, which is shmg.org.
And you'll be there to answer questions, to talk with people about some of the things that we touched upon today.
Yes, absolutely.
It is great and amazing to think it could last 30 years.
I know.
Great technology. Thank you for being here with us today.
Thank you.
Yeah, we'll be right back.
Thanks, guys.
This is 8 West.